March 26th board meeting to order for the Nashville General Hospital. So welcome everybody who is in attendance. First of all, I'd like to offer anyone who has a conflict of interest to go ahead and disclose that at this time. A conflict of interest? Seeing none, we'll move on to the mission statement. Let's see. Yes, Dr. Nettles, would you like to read that? Thank you.
All right, thank you. To improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers and translating science into clinical practice. And the mission is for leader in exceptional community health care, one neighbor at a time.
Great, thank you so much. I love your energy too, by the way. That's great. Next is we will offer, next item on the agenda, we'll offer opportunity for public comment. Is there any?
There are none.
Okay, seeing none, we'll move to the minutes. If everyone's had an opportunity to review the minutes, I will entertain a motion to approve the minutes for February 26th Hospital Authority Board meeting. All right, there's been a motion. Is there a second? Any further discussion? All in favor? Aye. Any opposed? Motion passes. No old business, new business. We'll be moving on to department reports, starting with Christy Lewis, our Chief Compliance Officer on Quality. Thank you.
Good afternoon. I'm Christy Lewis, Chief Compliance Officer, here to give the report for quality. I do believe that you have the information in your packets. So I will start with that. For hospital-wide, we have had 0 falls with injuries for 6 consecutive months. We have improved our leapfrog hand hygiene observation goals for all units from January to February, and we have gone back to exceeding our benchmark for that for 95%. We have also for the barcode medication administration rates, adherence rates, we have exceeded our benchmark of 95% for 11 consecutive months. Also for healthcare acquired infections, we have gone an entire year from January to January without any incidents, and that's for the central line associated bloodstream infections, for the catheter associated urinary tract infections, for MRSA bacteria. For MRSA bacteria. We also have the same thing for the year to year, and that is for the surgical site hysterectomy and for the surgical site C-sections. I would like to mention that there's an area in here where it has all of your gray areas. That is on the first graph and on the second graph. Those are indicating areas where we were unable to pull reports out of our Cerner. We learned that in January that we were unable to pull that report, which means now that we are going to go back and use a statistically valid sample size for our charts, and we are going to start doing those by hand until that we have that remediated. So that's going to be our remediation. So when we have our next quarterly report, then we will have a full report that will include February's numbers that are not here. Yes, sir.
Are you able to access clinic records for postoperative visits, or is this only no surgical site infections during the initial hospitalization?
It's my understanding this is coming in during the initial hospitalization. But if that is something that we need to go ahead and include, I will make sure that is included. Okay. Okay, our sepsis bundle compliance rate continued to beat the benchmark of 58%. As you see that they are continuing to improve. Of course, we are wanting to get closer to our 100%, but I am very pleased to announce that we are continuing our improvements in the 63.6%, and well as for February, the 64.3%. And finally, I'm very pleased to announce that Nashville General Hospital has remained or now is back in good standing with the CMS conditions of participation. This means that we can continue with our participation in the Medicare program, and all of our surveys have now been closed. Are there any comments or additional questions? All right, thank you.
Thank you. If there's no further questions regarding Ms. Lewis's presentation, I will entertain a motion to approve the quality report.
So moved.
I've had a motion. Is there a second? Second. Is there any further discussion? All in favor?
Aye.
Aye. Any opposed? Motion passes. Thank you. Up next is medical staff reports. Dr. Miller.
The Medical Executive Committee met last week, and there were again a large slate of faculty and staff that were put up for appointment and reappointment, and Dr. Bullock is going to read this list.
All right, good afternoon. We had quite a few people. So for initial appointments, we had Dr. Rafa Ahmed, Dr. Mickey Chalbach, Dr. Mark Clemente, Dr. William Mahard, and Dr. Selaski Nakama. All of those were radiology. We had Dr. J. James Halbert in obstetrics and gynecology. We had Emily Rogers, FNP, for our sexual assault nurse examiner team. Sherry Patrick, NP, for our behavioral health service line. For our reappointments, we had Dr. Eric Gresheimer, CRNA, anesthesia, Dr. Edgar Lee, emergency medicine, Dr. Ashley Nickerson, cardiology, Keith McCord, PA, orthopedics, James Stinby, radiology physician, Dr. Kevin Billups, surgery, Dr. Philip Elizondo, surgery orthopedics, Dr. Brady Tyler Harris, Department of Surgery. We had 2 additional RNFAs that were approved for reappointments in the Department of Surgery, Ms. April Martin and Ms. Leanne Thomas. Those are all the initial appointments and reappointments. We had 1 resignation, Ms. Ira Vinyas, NP, from the Emergency Department to explore a new opportunity. And additionally, as we look to update our privilege forms per departments, we had our certified nurse midwife privilege form updated by Dr. Apia, and the emergency medicine privilege forms approved by myself. Both of those were approved by the Credentials Committee as well. Are there any questions that I can answer?
Is there a motion to approve this report?
So moved.
Second.
Aye. Okay, motion passes. Thank you. Appreciate that. Next up is our committee reports. We have 3 different committee reports for today. So the first up is the CEO Performance and Search Committee for Mr. Esquivel.
Thank you. The CEO Performance and Search Committee continues its work. We met last week. I direct your attention to pages 25 and 26 in your board packet that contains the minutes of our meeting last week. And in particular, I'd point the board to page 26 of the packet and the timeline there. So the committee now has, working with our search firm, executive search firm that is consulting with us and assisting us with this, developed this timeline for presentation of candidates. You'll see that on April 15th, the firm is going to present to the committee approximately 10 candidates to proceed to the next stage of selection. We'll have some deliberation and discussion about those and select a first round interview group of 5 or 6, we'll call them semifinalist candidates. There are dates set for committee members to have the opportunity to interview those candidates, and then we will meet again after those semifinalist interviews are done to select likely 2 or 3 finalist candidates. Those, at that point in the process, it will be a more robust set of interviews and discussions. We anticipate that each of the 2 or 3 finalists would spend a day and a half or potentially 2 days meeting with, having interviews, formal interviews with the committee and board members who can participate, but also discussions with our partner organizations, people in the community, have a really broad opportunity for our candidates to talk with and have interactions with all the various stakeholders in the hospital. That would lead to on either June 10th or June 24th, depending on when we can schedule those visits. The committee will meet to recommend to the board a candidate that we would extend an offer to. And that would come for board consideration, we think, at the July 25th meeting. So we now have a set schedule. We have a process in place. I will say generally the response to this position has been very promising and much and higher than AMNC's in other searches. The amount of interest in this position is really good, and so we think that we're going to have a very good slate of candidates to consider, and that's promising and good so far. So that's the structure and the timeline. And I'm open if anybody has any comments or questions about that.
David, will we receive any type of information on these 7 to 10 candidates before April 15th? The committee will receive information from the search firm about them so that we can sort of make our deliberation. And will they be identified or de-identified?
Currently, counsel for the board from Metro Legal we are working through like the specifics of that. They may be de-identified in the sense that their names and sort of information that would allow us to know exactly who they are going to be at that stage of the process de-identified, but we may have more full information. We will have the information about their credentials, about what work they're doing in a way that doesn't identify them. And just for the board's information, we're striking a balance here in terms of the information between respecting the privacy of a relatively large group of people who are interested in this position and our obligations to conduct our deliberations in public pursuant to open meetings laws. The privacy of the candidate is important so that we're respectful of them in this process, but it is also to our benefit to do that because we may not have good candidates who are currently excelling in their current roles want to have their identities known. They don't want their current employer knowing they're looking for another job. And so it will detract from our candidate pool if everyone who expresses an interest and gets to that stage of the process has to be publicly identified. So all of those various considerations, but Derek and I have been working on that and are confident that we're going to have an ability for the committee to get full information in a way that respects all those different categories.
Any other discussion or questions for Mr. Escobar? Again, thank you for your work on this. This is, I know, a lot of time and effort that on your part that's gone into this and coordinating with our search firm. And so I appreciate you bringing that to us and excited to see the outcome and appreciate in advance everybody's time as you lean in. And these are going to be 3 long days of interviews. And so we know that that's going to be a commitment, but this is an exciting time and a great opportunity. So thank you in advance. Next up is Advancement Committee Report. Craig Lesser, Kathy Poole, and Olympia Williams, please.
Thank you, Madam Chair. I would just make one note here. In the minutes, there's an indication that Dr. Scott was not at the Advancement Committee meeting, but we have made that correction. He, in fact, was there. So the minutes will reflect that from the last meeting. It was a pretty extensive meeting, and I would urge members of the board to review the notes and the minutes. And in the meanwhile, we are going to go into a marketing strategy session towards the end of this board meeting to discuss strategy and marketing, but as a foundation for that, we have asked Kathy Poole to talk about some of the activities that have been occurring and to give us kind of a foundation for the next phase of our meeting. Kathy?
Thank you. So in your board packets, I accidentally printed like a very large size, but this is information on what has been happening at Nashville General Hospital, where we've been out in the community. A couple of things that those of you who are in the advancement committee, it's the same information. But since we're in the actual March board meeting, I do want to make special note under the government relations, the third to the last bullet point. The Minority Caucus held their annual reception at Cal Turner on February 24th, and Dr. Elders received the Minority Caucus's Chair Award. So just congratulations to Dr. Elders for that. So we've been doing a lot of work in government relations. Megan Frazier with HBS, our state lobbyist, will be here for the strategy session. And then other items to note are the clinical growth and innovation. We did launch our pediatrics, so we are now seeing kids 5 to 105. You'll see the poster when you walked in the hospital at our Bordeaux location. So we've been very excited about that. There's billboards, a lot of social media ads surrounding that launch for, the younger children. And then Freenome with our colorectal cancer simple screening. Dr. Fair, I want to give her and her team huge kudos for what they've done. We had competed, I'll just say so. We are one of the first hospitals in the nation to offer this prior to, I'm going to get this wrong, it's early access program for this blood test. And another hospital from a much larger system in New Jersey had their event, and they maybe got 19 people. We got over 37, or right at 37 at our event. And then we are still getting phone calls. The Belcourt Theater is going to be screening a show, and because of all the media around it, has asked us if we could participate on April 8th. So there will be more information about that. So just kudos to that team.
Kathy or,
Yes.
or Dr. Fair, you might want to spend another minute on what this is, because it's pretty significant.
It is, and I will defer to Dr. Fair because she does an exceptional job with this. She's been on Channel 2. She will probably be at the Belcourt event. Come on up.
This is a blood detection test for colorectal cancer, but it is proprietary, currently under FDA review. It is looking at genomics, metabolomics, proteins, signals in the blood that would detect risk for colorectal cancer. Why this test is so significant and timely is because the young age of individuals that are at risk to have later stage of colorectal cancer without screening. And as many of us know, the thought of getting a colonoscopy can be very fear-inducing, and also there's a lot of barriers to that. That's not to say that if someone doesn't have a positive result, a signal in the blood that may suggest they have colorectal cancer risk, we have a system in place to refer them, of course, to Dr. Maliakal and his team.
So you might just share another second on how we ended up with this trial.
Well, it's because Nashville General Hospital supports their workforce, and I was invited to present at a conference September 2024 on social determinants of health. And we were, because of our presentation on all of them, our key services that we offer at Nashville General, the food pharmacy, the no-wait ER. We had a suite of things that we presented. A Freenome representative came up to our team. And we've been pursuing this with strong support of course, our research team, marketing, lab, contracts. So this was a joint effort that began in September 2024, and we are the first commercial partner, and we have had a lot of positive amplification because of it.
Dr. Fair, I knew the answer to the question, but I wanted everybody to hear. Thank you. Thank you very much.
Thank you. And then, yes. Another celebration that we had today was our robotics surgery. We celebrated our 500th robotic surgery today. So you'll see something on social media in a little bit. Chanel's actually back there trying to get it all ready to launch tonight. So just celebrating that team for the work that they're doing, and ensuring our patients have standard of care when it comes to robotic surgery like every other hospital in Nashville, and that's truly important. And then we will be celebrating the entire medical staff. It is National Doctors Day on Monday, but we're going to include all of our providers. We're working with Meharry, so Meharry Medical Group, we're going to have a big plaza party outside by the ambulance plaza to celebrate our providers Monday in honor of National Doctors Day. So, yes.
Excuse me, 500 robotic surgeries. I think that deserves a round of applause too.
And I believe they're really at like 5:30 something. So, yeah, exciting news there. Other engagements that we have going on, STEM Goes Red was this week at Meharry Medical College. Dr. Faye, one of our eye doctors, she was actually participating and able to close out that session. We have the community baby shower this weekend, again with Meharry Medical College over at Nissan Stadium. And then we'll also be in Southeast Nashville. We know that's one of our strongest patient populations for the Southeast Egg Hunt on Saturday. And then we'll be participating in some other events, including on April 23rd, which is the hospital's 136th anniversary, but not for the anniversary, for our medical legal exam team, our sexual assault nurse examiners. There is a special fund, part of the Nashville General Hospital Foundation, named after Sandy Myers, who was the first nurse practitioner who handled sexual assaults within Nashville General Hospital. They will be, you can dine at Bottle Cap. Proceeds of the funds from dinner that night will go back to the foundation, and then go enjoy some Jenny's ice cream right around the corner from there. But just, we have a lot of great stuff going on. When we get into the strategy session, we'll talk about how all of this kind of comes together under this Nashville General Hospital Marketing Division and how we want to push forward. Any questions?
Any questions from the board? If not, Kathy, thank you very much. And as you said, all of these things, all of these events, they contribute to the overall strategy, which we'll get into in greater detail. But it's also an effort to continue to apprise the board of opportunities to participate, to represent the board at different events, and to show, in particular, our employees, our commitment to them that I think everybody here certainly has. And I would urge you from time to time, when you see an event that is highlighted by Kathy and her team, if you can attend, it goes a long way. It means a lot to the people here at the hospital, the workers here at all levels, and the patients as well. So Kathy, again, thank you very much. Is Olympia here? There you are. And Olympia will give us a report from the foundation.
We are having an event at Jenny's Ice Cream 12 South. They're going to be donating 25% of the proceeds back to the foundation, as well as Bottle Cap. And the foundation itself, we're going to have a mixer here on the 11th floor that's inviting community partners and potential donors here to the hospital so they could interact with the leadership team here and get to know what the foundation and their initiatives are.
And remind us again of that date for everybody to write down.
Yes, April 28th from 5:30 to 7:30. And we hope to see you all here. And you all can, if you know somebody, you can invite them to come here as well. Last but not least, the foundation's primary focus for the next quarter, I'm going to be seeking out different grants and applying for those grants so that we can ensure to continue to support the hospital initiatives. Any questions?
Questions or comments for Olympia? If not, Olympia, thank you very much for your work. We appreciate it. Madam Chair, that's a report from the Advancement Committee. If anybody has any questions, we'd be happy to take them. Otherwise, we're done.
Thank you very much. Appreciate your work on that, and thank you to both Kathy and Olympia for your reports as well. Again, encourage you to attend as many of these events as you can and support the doctors and obviously the foundation. Next up is a Finance Committee report. So Dr. Nzerue and Dr. Blackledge.
Thank you, Madam Chairman. I'll invite Dr. Blackledge to give us the highlights of the finance report. You have a separate package for that, as well as an updated income statement sheet.
Good afternoon again. Thank you, Finance Chair. Thank you, Board Chair. I want to take an opportunity to introduce Coleman Griffith, better known as Cole. Cole serves as our accounting manager in the finance department. Cole has been with us since August. He has a background in healthcare, private equity, startups. He joined us, rolled up his sleeves, and he hasn't stopped working or slowed down since he came on board. Welcome, Cole.
Good afternoon, Board, Madam Chair. Excited for this opportunity to highlight our February financials. As Dr. Nzerue noted, you do have a separate packet of financial reports that I'll reference the page numbers as well as kind of some numbers here on the screen. To get us kicked off, I'm going to highlight our statistics for the month of February, which is on page 4 of your financial reports. Very specifically, I want to note the positive results around admissions and clinic visits, specifically compared to the prior month. We rebounded as a organization very positively from the end of January when we had the unexpected ice storm and had to close for 2 to 3 days there. So you'll see overall positive trends on both of those from the prior month. Admissions for the month of February were 210, which was up by 6 from the prior month, slightly under budget there. And also the clinic visits, February was 4,027, roughly an increase of 600 from the prior month of January, and then fallen slightly short of budget for the month of February is there. But very nice rebound for the organization. Also wanted to point out our cath lab is up and running. 32 procedures or we'll say visits within the month of February, 21 from January, and then definitely note prior year 0 there. So very positive movement direction there for the organization. Those are just some high-level key statistics that really drive our income statement there, which is on the following page of your packet. And we've got some key metrics up here on the screen that I want to highlight here. Gross patient revenue for the month came in at $25.8 million. As you can see, under budget by $1 million there. Really kind of, I don't want to overuse the term continuing the trend of the year, but slightly under budget there. And one item I did want to point out is looking at the details in the prior months, we had been kind of under budget in inpatient, and you'll see a flip as a positive variance of $900,000 for the month of February. That is directly attributable to, I previously mentioned in the Finance Committee, a combination of two things, improved rates from health plans, and then also just improved collections, very specifically DRGs that relate to Medicare and Blue Cross Blue Shield there. Also wanted to highlight too, as we get down to net patient revenue, you'll see we came in at $6.6 million over budget by $900K, which is great. Big part of that is the improved rate and then collections that I just noted there, but also we're starting to see some stabilization around revenue deductions, kind of all aspects there, and a lot of moving parts there, but it's just really highlighting the overall effort of the team and even work when KPMG was here, and we're starting to see just normalcies in the model and being able to evaluate it better and recognize revenue, which is really good overall as an organization. Kind of following the trend down the income statement, once you include state funding and subsidy revenue, we had a total net revenue total of $13.8 million for the month, which is a positive variance of $500,000 to budget there. So I'll stop and ask if anybody, the board has questions regarding revenue.
I'm no accountant, but gross patient revenue, is that the same as charges?
Yes, it is.
So, I mean, it seemed like it would be probably an easier way to reflect it if it was called charges rather than revenue, because the revenue comes in the next one, which is net patient revenue, which is actual collections, right?
It's really, so net patient, in a way, net patient revenue is what we expect to collect for the revenue. So we have our gross charges. So I'll use myself as the example. Cole comes to Nashville General today and has a colonoscopy. Our gross charges is what's billed to the health insurance plan. Then we take into effect any contractual adjustment, agency line items, potential bad debt, charity adjustments to net that down to what we expect to collect as an organization.
Then that would be the net patient. And then how's that different from the total net revenue?
So the total net revenue line of the $13.8 million, that includes the funding we receive from our Metro subsidy. On a, we'll say it's on a monthly basis, and any miscellaneous programs, whether it's dish payments, PHSPP, we amortize some of that over an annual basis there.
So I guess my only suggestion, and maybe this is, again, my accounting skills, but that the gross patient revenue maybe ought to be referred to as charges.
Yeah, well, definitely, I've got that noted here and appreciate the feedback for sure. Hopping down to expenses, really not going to elaborate too much on expenses in detail outside of our total expenses were $13.7 million, roughly $1.1 million over budget, but also a positive variance to prior month of 14.1. We really, as an organization, just from a line items perspective, just saw the continuing trends that we've seen for the fiscal year, whether it's salaries, kind of other drivers, pharmacy expense, contract services, physician services there. Considering all those items, at the end of the month, we came in at a operating margin of a positive $107,000, which is great. It's in the positive, under budget, but I did want to note as well, as the far right on the screen, our year-to-date total. So we're 8 months into our budget fiscal year. Our operating margin is a positive $4.2 million. And compared to last year, it's almost a $20 million swing. We were at negative $15 million, which speaks to just the testimony of the hard work going on at the organization-wide. I will note roughly $10 million of that is related to revenue received due to timing. It wasn't received last year on time, so that's kind of a one-time pickup there. But even considering that as well, really that $4.3 million is a true testament to the hard work that you as a board and the organization has put in, and it's showing on our financial results. Any questions regarding the income statement? Okay, perfect. I will note page 6 and page 7 on your financial reports for the board is the February balance sheet and the February cash flow. No material changes month over month there, so I'm not even going to dive into specifics, but happy to answer any questions that a board member may have regarding either one of those. Okay, perfect. there's no questions regarding those financial statements, I will turn it over to Dr. Blackledge and let her speak to revenue cycle.
We typically don't cover revenue cycle here, so I will not unless the board chair is making a request for me to, but I'm happy to entertain any questions. In Finance Committee, I did share that we submitted a revised budget to Metro Finance. That revised budget was an increase of about $8.3 million, covering 3 categories, which brought our request for city subsidy to, I think it was 75.3. But happy to answer any questions related to finances or any other matter.
As part of the increased request from the city, did we submit what we would expect to be expected revenue changes during that period of time?
Yes. Yes. So from the revenue growth component. So if we are today trending towards 300 million, then we have 333 million submitted within the budget. Thank you, Madam Chair. I turn it.
Motion to approve the financial report for February.
Second.
All in favor?
Aye.
Any discussion? Any nays? Motion passes. The first one is the AROP lab contract. It's a reference lab, pretty well known, and the hospitals use this for a good while. The term of the contract is from April the 1st, 2026 to 29. It's an auto renewal. The annual cost is $395,000. It's actually a decrease from $435, which we paid on the old contract. So there is some net savings. There's no formal RFP. Any questions about the AROP reference lab contract?
I move that we approve the contract.
Do I hear a second? Any discussion? All in favor, say aye.
Aye.
Any opposed? Motion passes. The last contract is the Agiliti Health Incorporated, and this has to do with facilities management. It's a GPO contract for 3 years. The total cost, the annual cost is $54,000 the first year, $57,000 in year 2, and $60,000 year 3, adding up to a total of $172,000 for 3 years. Again, no formal RFP. Any questions? Do I hear a motion to approve? Is there a second? Any discussion? All in favor, say aye. Aye. Any opposed? Motion passes. Thank you, Madam Chairman.
Thank you. Next up is our interim CEO report. Dr. Elders.
Thank you, Madam Chair and Board. You have a separate handout within your packet. We felt it necessary as a leadership team to provide a year in review. This administration changed March of 2025, and so 12 months since that time. We've achieved significant progress across leadership, operations, financial stability, community impact, as well as our workforce culture, setting us up for success in the future. So how do we start March 2025? We started on the heels of a Metro audit that revealed multiple allegations that were substantiated, primarily in regards to contract governance, vendor oversight. We had compliance risks as well as internal control deficiencies. This administration made a commitment to transparency. We ensured that we implemented a range of governance and compliance actions, redesigned our contract submission process, as well as sent our leadership team through mandatory leadership training and adopted technology, DocuSign, to track on some of those contracts. And we're fully implementing DocuSign in the future for every single contract. Finance and expense management, your next page. We did significant leadership restructuring to streamline our decision-making and improve accountability. And so right around February of 2025 and into March, we had 16 chief executive team members. We reduced that to 6. There were 117 middle management positions. We reduced that to 67. And through turnover reduction and schedule adherence, which was led by the finance team, there was approximately a $900,000 combined savings. We also initiated a shrink to grow initiative and did contract services reduction in about $1 million. Contract labor reduction yielded about $7.2 million. And then with the leadership and the closure of the operational performance department, that was a savings of about $4.5 million. If you recall, we did have an urgent care clinic at the Bordeaux location on Saturday and Sunday. We changed that as well. That was about $400,000, and then did not renew the lease at our Charlotte location, so that reflects the closure of Midtown, and that was a 14.7 annualized savings over that time period. At the same time, it was requested that we look at our financial infrastructure. So KPMG came in and provided a comprehensive set of tools for us to look at our accounting policies, reconciliation workbooks, as well as our financial statement improvement. And I'll just go back. So if you go to the next page, one of the things that they found during that time here and shared with us and our team is that we weren't following generally accepted accounting principles. And so Dr. Blackledge and her team has worked very hard to address 4 key problems with accrued expenses and invoice processing, revenue and account receivable variances, deferred reconciliation and contract accounting issues, as well as our HR and payroll control issues. And as reflected in our financials, you can see the hard work and improvement that they've done. Now, I have a snapshot in time, and so I'll just explain the variance and what was presented today. I did this report early March, so this was based on the January timeframe. So I just wanted to share what that is. That was from February to January 2026. That's what I had available when I did the report. So you see, during that time, we're at a $2 million positive year to date, which was a significant improvement from the negative $15 million. And so with our account payables improvements, there was a slide that was presented in our February board meeting. So this is the same picture from that slide. You can see our AP days and how they've gone down. And so again, a snapshot in time, our AP balance from February of 2025, $15 million to January, which was about $8 million. One of the reasons we are requesting or have put in that additional request for vendor management, we have some aged AP that we just really need to get addressed. So for strategic partnerships and community infrastructure, I truly feel like Nashville General Hospital and the team is pretty much aligned with our Hospital Authority Board, the Mayor's Office, Metro Finance, our Metro Council, our State of Tennessee, Davidson County delegation. And so we went on the Hill and met several representatives. We've gone to Metro Council and our partnership with Metro Finance. I believe the Finance Department does just a beautiful job of doing that now, and that hasn't always been the case. So our partnership with Meharry Medical College, there was a professional services agreement that was signed September of 2025. There's an ongoing partnership with Dr. Hildreth and his leadership team. We've established a PSA Finance Committee as well as a PSA Joint Hire Committee, and our teams talk very frequently. I meet with Dr. Hildreth monthly, and I believe that partnership is just very collaborative at this time. And that is progress that has been made that didn't exist prior either. We've renewed our partnerships with the Tennessee Hospital Association, HBS Strategies, which is our state government relations. We have an executive session after this. Finn Partners, as well as the Nashville General Hospital Foundation Board, because that relationship was fractured also. We partnered this year with Metro Public Health Department and the Metro Office of Family Safety, as well as the Metro Office of Homeless Services, and worked their cold weather shelter this past season, providing them with health resources during the time that they were opening. And then after Storm Fern, we did staff the mayor's disaster assistance centers and helped with a medication clinic for those who lost their refrigerated medications during that time frame when we did not have power. Two other programs, just to mention, the Tennessee Diaper Program, we joined that, and then of course our collaboration with Hope Meds in partnership with the Dispensary of Hope. We've been able to save our families about $500,000 in medication cost. So when we look at workforce culture and organizational transformation, we implemented Cerner. Our employee engagement survey had 80% participation for the first time that I've been here in my tenure. We also partnered with Deloitte through a agreement with Metro to do a human resources assessment, and we are strategizing and we'll bring in a new HR senior director very soon. His start date is May 4th. We also implemented UKG workforce management system to help with our human resources and payroll processes. And then we talked about our robotic surgery, 500 cases that is to be celebrated. That robotic program, it took a while to get up and running, but we have reached that landmark. Our cardiac cath lab and our new cardiac CT program has been established early 2026, and the cath lab should be fully, they did 4 cases, I believe, this week. It might be 5 by now, but this week, and then should be fully operational Monday through Friday next week. And we started pediatrics primary care at the Nashville Healthcare Center at Bordeaux, and then, of course, we've highlighted Dr. Fair and the research team for all the wonderful things that they're doing, as well as the Free Gnome project. Your next page goes over our capital investments and facility repairs. We were awarded $5 million in the capital spending plan for this fiscal year, as well as another $2 million for 4% capital allocation. That will be for our visitor elevator repair, and it couldn't be more timely as we've had multiple people needing assistance to get off of them recently. But we've done all of these things for HVAC. If you look at our equipment, we were able to replace all of the mattresses house-wide, which was something that wasn't in compliance, and get a number of other equipment items for our providers, as well as look at our hospital security upgrades and weapon detection system. If you see the new entry, that will be part of our visitor management system once it's all done to control the traffic going in and out of the hospital at night, because there currently has not been any control until now. I'll move on to the Tennessee Department of Health survey. So we've shared that the Tennessee Department of Health did an unannounced survey. They entered August the 18th and exited November the 26th. We submitted our plan of correction for that time on December the 12th. They also came back December the 1st and left January the 7th. Originally, we were told that there was a procedural error, but we did get a formal 2567 on yesterday that closed out that December the 1st through January timeframe. There was a revisit conducted January 13th through January 23rd. We submitted that plan of correction on February 19th and then had to go back and provide some clarifying recommendations or clarifications on March 6th. They did a revisit on the 17th, exited on the 18th, and we are back in compliance, and that closes out all of our activity with the Tennessee Department of Health and Health Facilities Commission on behalf of CMS. In addition, for our quality and patient safety, through our partnership, this is Texas, it meant to say Tennessee, Tennessee Hospital Association, we renewed our status as a continuous readiness participant, so a CSR participant with the Tennessee Hospital Association contract. They came in on the 17th and exited on the 20th. We are awaiting their detailed report, But being a part of this subscription allows us to have education and consulting resources at a discounted price to ensure that we are always ready and have the resources we need to be successful in regards to Joint Commission, our standards of participation, just culture, and all of those things. So while we've made a lot of progress, there are some obstacles and difficulties on the road to success. And so I'll just mention a few of them. Our expiration of the lease next year. Of course, financial instability, which has been a long-term problem here at Nashville General Hospital, as we do rely heavily on our subsidy from the city to sustain our uninsured population. Operational strain during this transition. So I'll just have to give a shout out to this team because over the last 12 months, if you look at all of those Tennessee Department of Health days, we did all of this work in the midst of all of that. And this team is very, very, very resilient because not only did we have an administrative change, we also were operating in an environment of intense scrutiny. And I'll say the leadership team, the providers, and the staff, we pulled together and as we are all back in compliance, and we couldn't be more happy. Thank you. There's also safety net mission pressures as we are Nashville's only public safety net hospital. And that uninsured population, I'm sorry, but it will grow as we continue to move on within the next few years. And then, of course, public trust and reputation challenges following the Metro audit, the leadership controversy over the last 12 months. I think we're just now recovering. And so those are the top challenges that we have. But I will say as we enter into fiscal year 2027, we do stand on the foundation of enhanced financial stability, well-defined operational priorities, and a revitalized leadership approach. And with that, I just thank you all for your service. It's been a pleasure to serve over this last year, and we look forward to the future. I'll take any questions.
If I can just say it's nothing but remarkable what you've achieved.
Thank you.
On all fronts. And as a board, I think we're all very, very appreciative of what you've done. And the numbers speak for themselves. And the culture, maybe even more important than the numbers, is so much better. So thank you.
If you'd told me what was going to be accomplished by the staff a year ago, it would be, well, it's far beyond expectations. And in addition to have it carried out under the cloud of the surveys and to have concluded them in that amount of time is nothing short of amazing. So congratulations. I do have a question about the capital spending plan. Can you review for us where that $5 million came from and how we ask for capital above and beyond our budget? And the timing of that during the year, et cetera.
Sure, I will do that. So the $5 million was awarded from the mayor's capital spending plan for fiscal year 2026. We sent in some priorities. I think our board members kind of rallied around us being able to get those dollars, and so that was what was awarded for this year. They also do a 4% capital allocation quarterly, and I had a conversation with Madam Chair about our elevators, and we were able to get the allocation for the 4%. That's done quarterly. Now, we won't submit our capital plan again, Dr. Blackledge, I think till May. We'll submit the new revised, taking these things off because we have an ongoing list. of things that we need for this building. Now, I will tell you it's $43 million, and we know we won't get all of those things that are on that capital list. So we prioritize facility, life safety, things of that nature first. But that will be submitted in May, and then we'll be allocated based on what the mayor's office can provide during that time. Did that answer all of your question? I think you had one more thing no? Okay. We are doing a facility assessment, which we'll provide at one of the board meetings once it's complete. And so that's kind of where we are with facilities management and infrastructure.
Madam Chair, may I, as I look around and as we were hearing about what happened in the last year, I want to echo what Dr. Miller and Dr. Martin said, especially from the perspective of those of us that were here prior and literally labored under the previous direction, that all of these accomplishments in the last year are even more telling if you had been here before the change. And I too am very much appreciative of your work and the work of everybody on the staff here at Nashville General. You guys are kicking it, and we just have to do more, though. We can't be satisfied. We have challenges, but we also have opportunities if everybody is working together in the same direction. So thank you, Dr. Elders.
You mentioned $43 million. Is that $43 million you think in facilities and capital improvement?
Yes, sir. Yeah, facilities and capital improvements. That's the number. Well, the facilities assessment in 2023 is $395 just for the building, and so we imagine it's going to be even higher than that. And so, there's some equipment things that we would like our providers to have, but it's not a lot of equipment. It's basic infrastructure needs in that 43.
Is the structure of our contract with Meharry that they do not contribute to any of those facility costs?
We are in a triple net lease, which means we do utilities, taxes, as well as maintenance. Yes, sir.
But I dare say nobody here was part of the negotiation of that contract.
Madam Chairman, I just want to echo some of what's been said and just celebrate the transformation that on the Meharry side, and as a physician that I see, the leadership has really been totally dynamic, very collaborative. And when we started the robotics, there was some concern about the cost, but that's the standard of care in many surgeries these days. So that is really a testament to how they've been able to get the providers together and get the buy-in from the nurses, facilities, everyone pulling together and just having so much team spirit. It's a cultural thing, and culture is a hard thing to change in the time that the leadership has done it. So it's taken a lot of heavy lifting, and it's just been totally remarkable. And I just want to echo that the leadership has really done an amazing job.
Of course, I'm going to do the same thing. Absolutely incredible. What I appreciate most is asking the hard questions and being very persistent in getting answers and even getting more detailed answers, and also the problem-solving skills and abilities that have gone into it. And that takes a lot of courage. It also takes a lot of resourcefulness, and to keep asking the questions. So continue that, kudos. And this is a very proud time. And I also think it's a very prime time for the to increase our census, both inpatient and outpatient, which is the next step. So all of this had to be done in order to increase our census. But kudos.
Well, I would be remiss if I didn't have a comment. When I came to this board, my clarifying statement was we need to first get proficient at the things that we're supposed to do before we can go ask for more. And so when I hear the reports and I see the results of measured performance and outcomes, to me, it seems like we're now getting on a level of normalcy. And to me, it seems that things are moving, not just moving in the right direction, but actually are in the right direction. And that's a testament to everyone that has been directly involved. I would say that, you know, to not belabor the point, the fruit doesn't lie. There is a lot of good being done here. So definitely kudos to the team and everyone involved. And I'm just here to make sure that we do the needful and get this hospital where it needs to be. But congratulations to you all.
Thank you for all the comments. I want to do two things in my closing comments. First of all, thank you for putting this together. I think it is difficult when you come in at various inflection points, whether you're a board member or you're in staff or even listening to this wonderful meeting that we're all having. But, you know, to see it all wrapped up and to literally look back and know that this happened in 1 year is truly tremendous. So the first thing I'd like to do is also start out by asking the provost, who is our partner, our dear partner over at Meharry, if you'd like to make a couple comments about what you've seen maybe over the last year. So if you'll do me a favor, you're welcome to take my microphone, and love to hear from you.
I appreciate the opportunity to speak to the board. And I want to say that it has been definitely a cultural change to be able to work with a new team, a new leadership team here at Nashville General Hospital. I think that the way that we've been welcomed to the table is really important. I do not want to miss the opportunity to say there's work still to be done. And I want to say that this is a step in the right direction, but Meharry is a partner that needs to be paid. And this is something that was not discussed. And I cannot miss this opportunity to say there's been great progress, but our residents are working here in this hospital, and that has not been resolved. And that is something that has to be handled from a financial perspective as well as a training institution. City hospitals are important training institutions because they create an environment for the next generation of clinicians to come and care for the city. And that has been Meharry's mission for 150 years. It's our sesquicentennial this year. And it is the mission of all city hospitals. But we cannot do it without being paid for our residents. The residents work for us. We fronted the money for the salaries, the benefits, the support services for the residents. But we have to go through the hospital to get those CMS dollars to then reimburse us for that. That is not working. So thank you for the opportunity to mention it. It's been, as I said, I'll go back, it's been a great cultural change to work with this leadership team. That must be resolved. That's 3+ years now that we're carrying that debt. And we don't have that kind of extra cash on hand. So thank you for the opportunity.
Dr. Elders.
So what I will say, I did meet with Dr. Hildreth. There are some discrepancies, I'll say, on to where we haven't been able to resolve that. So that is a true statement. Dr. Bullock has done a lot of the legwork in regards to calculations for these residents. She's our CMO. And so I did speak with Dr. Hildreth this week about the issues and concerns, and we are working towards a resolution for that. But we have, so for instance, we were notified that we have another IRIS audit, which looks at our residents and how they're paid or how they're allocated to other organizations. So the information that we are provided has to be correct, because as we said when we started this year, we started out with this looming audit from Metro audit in regards to other things. And so the residency pay is no different. We have to have the accurate information to pay that. And that's something that we're working through jointly. Do you have a comment?
Good afternoon again. First, I want to say thank you to our Meharry colleague for speaking up. I want to address and partner with my Meharry colleague around the comments that I heard. One, I want to unpack a few of those. The first comment I want to share is that we've been partnering with Meharry on the FY26 this year payments and the invoice. And so the invoices come with 4 segments. The last segment to be paid out is the resident segment. And so I'm happy to share that we've actually signed the invoice. We have all the information. And there's an old adage that says the check's in the mail, but I have to look at Cole. The check is coming because we literally just signed the invoice. So we have all of the information for the July. It has been uploaded. Our goal and intent is to maybe tomorrow or Monday, August will be complete, because keep in mind we have to upload all of this information, right? And so August will be complete. That August invoice will be processed and submitted, and then payment is forthcoming for that. And so the way the process works for us on our end is that it takes maybe about a week for each month. So we anticipate this to be caught up over the next several weeks. What I cannot account for or speak to would be the prior 2 years, because what I heard was 3 years. So I want to make sure that we are connected, well connected on this current year. But what we cannot speak to is anything related to the prior years. So I'll recap and say, of the 4 segments on the monthly invoice, the remaining segment to be paid was around our residents. The resident requirement has some data. We receive that data, we upload that data, we process invoice, we pay out invoice. That is our cadence, right? So the current year, the last component is being paid out. And so it'll probably be a month or so, maybe at the most a month. Okay, at the most in a month, in 30 days, we'll be current on that piece. We have accrued that amount, and so we have the funds reserved to pay out. And happy to take any questions around that piece, but I just wanted to tag in with my Meharry partner. I appreciate that, so that we get some clarity and we're on the same page about what we need to do next. I turn it back over to you, Madam Chair.
Thank you. And just to close the loop, there are conversations going on regarding the prior 2 years. So just to let this board and the general public know, that has not gone, it's not gone unheard. It has been proactively addressed, as you know, I'm sure, from your other colleagues I was in a meeting as recently as several weeks ago, and I actually followed up on that again today. So that is being addressed. So I just want, in terms of the comfort level of our viewing audience, and more importantly, the board and leadership team, those conversations are being those conversations are happening with the appropriate leadership and legal teams, both at Meharry and at Nashville General. So more to come, but it is definitely being addressed. So just want to make sure that that is said. Not to mention that these are also legacy issues that we have been handed that were not dealt with in a way that is obviously come to a conclusion that was agreed upon by both Nashville General and Meharry. So without going into any further detail, I just want to let you know that's been being handled and, ongoing conversation. So I don't have any further comments regarding our meeting today. I appreciate everybody being here. We will now go into a closed session for marketing strategy. So we need to have a roll call vote to go into that strategy session pursuant to Tennessee Code 68-11-238 for marketing and strategic planning. After the vote, so we'll go around and each person has to vote.
I will call names.
Yep. So Janet Lancer, I will turn it over to you. Thank you.
Okay. Esquivel?
Aye.
So you approve going into
I
session?
approve going into
Thank you.
session.
Harvey?
Aye.
Lesser? Aye. Martin? Aye. Miller? Aye. Nettles? Aye. Nzerue? Aye. Pitts?
Aye.
Smith?
Yeah, aye.
Thank you.
Thank you. So we will now move into the closed strategy session, and we will reconvene briefly for adjournment. At this time, members of the audience and the video crew, there we go. Or, sorry. Sorry. No other business other than the strategy session. At the strategy session will be conducted. So at this time, members of the audience and video crew are excused, and no further business will be conducted following the session. It was all my comments. Come on. So after the session is over, we'll all come back to the table to officially call for the adjournment from the opening meeting. And thank you very much. Our next board meeting will be Thursday, April 30th at 4 o'clock. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.